Yeah, the challenge for President Trump is he inherited a bad VA twice. So I was in Trump 1 as senior advisor to VA, and then went over to the White House as the Veterans Affairs advisor to the President Domestic Policy Council. And so he inherited from Obama a broken down VA. That veterans had long waits, the bureaucracy. Basically, what Democrats like to do is try to make VA healthcare the only socialized healthcare in the country. And we know that socialized healthcare doesn't work. So under Trump 1, we were really significantly fixing up VA, the big fixer upper. If you watch those HGTV shows, you got the big fixer upper here, then the prior tenants have really trashed the place. And so we did the thing called the Mission Act. And the Mission Act said we're going to massively reform VA healthcare to make it veteran centric. And so there are horror stories in Phoenix, veterans having long wait times, being on secret wait lists, having, literally not being able to get care and dying of cancer and those sorts of things. So there's big scandals. We did the Mission Act, which gave veterans the first choice. So if you're in healthcare, if you're a patient, even in DOD, you can pick the plan that you want. You can pick the provider you want. If I don't like Camp Pendleton, which I go to, I can pick up a PPO. If you've been historically in the VA, it was the only socialized healthcare in the country. And when government controls all the decisions in your healthcare, you get bad healthcare when they're unaccountable. Yeah. So the Mission Act addressed all those things. It was the greatest transformation of VA healthcare in over a generation. And the veterans liking the VA skyrocketed. They came back. They started using it. And they had full choice. And what that meant was we borrowed, being a military guy, I borrowed the things that worked well in DOD for VA. And we established things like the access standards that said you would never have to drive too far or wait too long to get health care. And that it would put it in the veteran's hand, not in the bureaucrats. So that happened, and we had massive reform, and veterans were coming back, and it was doing really well. And then the Biden people used COVID to say, hey, we're going to undo all the president's achievements in the VA, both in accountability and choice. And accountability is important because if you fail veterans, you should be held accountable. Bad employees should be fired. And so they brazenly stood up in a congressional testimony and said, we're not going to follow Trump's accountability anymore. We're just not going to do it. And they made a deal with the unions. And so if you have bad employees, it hurts your health care. And there's a lot of good employees, and it hurts the good employees. So under Biden, they said, hey, as you've seen in other areas in immigration and whatnot, it's not just VA. They said, Mission Act, we don't care what the Mission Act says. We're just not going to follow it. We're not going to go ahead and let veterans have their choice anymore. Let me give you a couple examples. I think it's easier to give a couple examples of what the Biden people did. There's a veteran, and I'm going to use Louisiana as my first example. There's a veteran in Louisiana who, under the Trump, was having good community care. Now, he is a legally blind veteran, and so he needed a provider close to where he lived. The closest VA facility was over a 60-minute drive. And he's very elderly. He's legally blind. His wife is elderly, has a hard time driving. So he had community care. He was very happy with his community care. And then under Biden, they said, you know what? We're not going to let you have that community care anymore. We're going to make you